Chief at Texas Children's Hospital, Dr. Jim Versalovic. Doctor, so glad that you're with us. Let's just start right to the 12 to 15-year-olds now able to get boosted. How is this going to help in school and just the overall spread of Omicron right now?
Well, this is a huge boost, literally, for so many young adolescents that are ready for their third shot as we begin 2022 with another surge. The Omicron surge obviously is impacting so many children and adolescents. So this is a very timely authorization. We're awaiting CDC approval, and Texas Children's, other children's hospitals are ready to move forward to continue to vaccinate school-age children and provide boosters to adolescents across this country.
And Doctor, all of us who have school-aged children, this is such a controversial issue. It's become a controversial issue. Take New York City. Starts today. It's safe and stay open policy. That will allow students who test negative to stay in school, even if there was a COVID exposure. Other districts, still a 10-day quarantine for exposure. What makes sense to you, given obviously the priority, kids need to be in school?
We agree. Kids need to be in school. They need to learn and grow with their peers, with their teachers. I would just say, first of all, testing is very important, extremely important. This is an extremely contagious variant, Omicron, in the category of the measles virus. So this highly contagious variant now is spreading rapidly. And so we must continue to provide timely testing, but at the same time, combine that with strategies to keep children at school, to continue to promote vaccination, to keep sick children at home. Of course, that's important to minimize the spread. Masking must be, of course, strongly encouraged, particularly now during the height of this Omicron surge. So testing, timely testing is important. It's the only way to accurately diagnose COVID-19.
And all these things are so important. Meanwhile, our kids are struggling because they need school. They need that interaction. They need the academic help, the social help, the emotional help. And now we've got Education Secretary Miguel Cardona warning that many districts trying to reopen are going to experience a lack of staff now due to COVID. So between the rise in cases among children and staffing issues, what do you think, Doctor? Do you think we have the tools to accommodate in-person learning and to continue, moving along in that direction? Because it was not easy at the very beginning, and a lot of school districts could not get its act together.
Yes, these are important points, and each school district, each school, frankly, is going to have to navigate this carefully. Obviously, we hope this Omicron surge will peak in January. We need to be very mindful as we begin this new year, of course, that we have another surge just like we had when we began last year. But we have the tools now. Fortunately, we've come a long way with diagnosis and treatment of children as well as adults with COVID-19, and we've come such a long way with vaccines now available to school-age children. We know how to behave safely, how to try and keep schools open. We know that staffing is a concern, and clearly that applies to healthcare as well as education across the board in many industries right now. And again, it just highlights the importance of mitigating spread through safe behaviors, masking, promoting vaccines. If we're sick and if our children are sick, to stay at home. We must continue to be vigilant because this is such a highly contagious variant. But at the same time, we need to go to work, we need to go to school. And so fortunately, we have many tools now that we can use to continue to work and get educated in person, and then apply virtual learning or virtual work as needed, as we're doing now.
And Dr. Versalovic, one of those tools is the vaccine. Obviously, across the U.S., about 30 million eligible children ages 5 to 17, they remain completely unvaccinated. Even, parents who are vaccinated think twice, really, when it comes to vaccinating their children, especially their young children. So what do you say to parents who make arguments like, they won't get that sick, or the vast majority of children, the vast majority of children are going to be okay, and I'm worried about what I put in my kid's body? How do you talk to moms and dads?
Well, we have to talk candidly. Here at Texas Children's and across the country, we're on that leading edge there with families. We have performed these trials over the many months in 2021, demonstrating the safety and effectiveness of these vaccines for children. Lower dose, same vaccine that has worked so well with adults. This is a race between vaccines and variants. We've seen this throughout 2021, first Alpha, then Delta, now Omicron. The reality is the variants get more contagious. They're fast, rapidly spreading variants. And so time is of the essence, and we just can't wait. We know many vaccinated parents have been reluctant as well. And my message to them is there is no need to gamble. It's hard to predict which children may have progressive symptoms and get ill enough that they need to be hospitalized. We have seen many, and we just shattered records here at Texas Children's just over the past few days in terms of pediatric hospitalizations, as well as new cases reported over a 7-day period. So it is important just to remind everyone these vaccines are working. The children we serve, those that are coming in, are unvaccinated, and we still have more than 80% of children in this region who still need to get their first shot. So we are working diligently on that and vaccinating thousands.